with that, Alexa, now I'm going to turn it over to you.
Great. Thank you. And thank you so much, Claire, for your presentation. I always love hearing you speak. So yes, my name is Alexa Davis. And before I begin, I would just like to acknowledge that I am presenting in, and this research was conducted in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people. So I am a graduate of the St. FX class of 2021 in nursing, and during my senior year, I completed my honors thesis focusing on the impacts of COVID-19 public health policies on the services that public health practitioners and not-for-profit organizations provide to people experiencing homelessness in Nova Scotia. I've also had some unique personal experiences that I think are worth mentioning as they've enhanced my overall understanding of this topic. I recently completed a 3-month placement, as Diane had mentioned, at the North End Community Health Center, where I gained firsthand experiences working with people experiencing homelessness during a pandemic. As well, when Nova Scotia was in the midst of our 3rd COVID wave at the beginning of this summer, I was working with public health to bring asymptomatic widespread COVID testing into shelters in the Halifax area. I'm now working as a research assistant at the Canadian Centre for Vaccinology with my previous thesis supervisors, Scott Halpern and Donna Halpern, on a larger project in which this thesis is situated in. I am also a community health nurse currently at the North End Community Health Centre as well. So throughout all these practices and academic experiences, I've been very fortunate that I've been able to use some of my research findings in my practice, which I will briefly go over today for you all. All right. So when I first started this project, there were no antiviral treatments or vaccines available for COVID-19. Therefore, public health policies were essential to mitigate the impacts of the virus. But while these policies are instrumental in flattening the curve, they are also disproportionately impacting people who are unhoused. Without a safe and secure place to sleep, wash your hands, and just protect yourself from the spread of disease, people experiencing homelessness are at an increased risk of contracting the virus, spreading it to others, and having adverse health outcomes. So my research question is how do public health practitioners and not-for-profit organizations who serve homeless populations in Nova Scotia interpret, conceptualize, and implement COVID-19 public health outbreak control policies? And what are the most critical factors that support and inhibit COVID-19 public health outbreak control policy implementation? So through a qualitative approach, I conducted a preliminary document review, as well as semi-structured interviews with public health practitioners, as well as not-for-profit organizations, staff and leadership, including various organizations, including men's shelters, women's shelters, transition houses for women and children experiencing intimate partner violence, youth shelters, and community-based programming, as well as primary healthcare services across rural and urban Nova Scotia. So these are my 3 themes and subsequent sub-themes, and as I briefly go through them, please feel free to read along with some of my supporting quotes as well. So a perfect storm, my first theme, often refers to the detrimental impacts of individual factors coming together to cause an effect greater than the sum of its parts. And throughout the interviews, factors impacting people experiencing homelessness were identified as intimate partner violence, addiction, and food insecurity. And while addressing these issues in the context of a pandemic has created significant challenges for service providers, they've also demonstrated that there are strategies to address these issues. So the first sub-theme, Converging Pressures, discusses all these intersecting issues that need to be considered when implementing policies, such as addiction management and harm reduction initiatives. Now, in this theme, we heard from participants that pre-existing issues have really just been magnified even more during the pandemic, highlighting the very acute and extensive needs of this population. Now for the second sub-theme, every cloud can have a silver lining. There were definitely setbacks or clouds in participants' work as their focus shifted primarily to the COVID-19 response. But out of this very harmful situation, this quote is just an example of some of the silver linings that participants had mentioned. So the second theme, some assembly required, illustrates that while we're given the tools on how to curb the spread of disease, including self-isolating and staying home, many of these measures are just not feasible in the nonprofit sector. And this gap between policy expectations and reality has required a very flexible and intersectoral approach. So this quote in the first sub-theme, "One size does not fit all," describes this disconnect as language such as, stay the blazes home and stay 6 feet apart is being used to describe these policies. The second sub-theme, hitting the ground running, details the actual work and supports participants implemented in the nonprofit sector to adhere to these policies. Participants noted how changes in service delivery were necessary to provide safe and competent care. Now, this third sub-theme, It Takes a Village, captures this collaborative community action that was needed to respond to the pandemic and is still needed. There were a variety of stakeholders, including hotels, cab companies, public health, not-for-profits, who really stepped up and formed partnerships with one another to serve people experiencing homelessness. Another important thing to note with this one is that just the transportation piece as well, especially in a rural context, as even before the pandemic, they had limited to no public transportation and just faced increased geographical barriers to accessing services. So this third theme, behind the mask, illustrates the increased roles and responsibilities that are put on participants. So the first sub-theme, identity in the face of change, describes the participants' views on how their professional and organizational identities have been affected. This quote illustrates how changes in service delivery have impacted relationships and participants' ability to connect with their clients in the same ways. Now, as participants noted these shifts in relationships between clients, there were also shifts in relationships between public health and non-for-profit organization stakeholders. Participants noted the shared leadership and information sharing, just increasing the visibility of each other's strengths and contributions. Now, in this second sub-theme, burning the candle at both ends, participants noted that working in an environment of fear and uncertainty can have major impacts on anyone's, health and well-being. And to compound the increased demands, there were also major staffing problems during the pandemic. This impacts not only the clients who are receiving care, but also the providers who are then, understaffed and quite overwhelmed. So throughout the discussion, I looked to the literature to support or to cement my findings. So just briefly overall, Nova Scotia is in the middle of a housing crisis, meaning there's limited safe and affordable housing available. Now, this is an issue across the entire province and even more so in rural areas where there's fewer housing programs and services. These conditions in the best of times have large impacts on all Nova Scotians and considerably more on equity-seeking groups during periods of upheaval and crisis. Now, policy implementation gap acknowledges that policies don't fail on their own, but because of the systemic barriers that exist in complex systems. In this setting, barriers to implementing policies include lack of available and affordable housing, the congregate and overcrowded nature of the shelter system, as well as just the limited pre-existing supports. As governments impose stay-at-home orders and mandatory isolation, the literature warns against people experiencing homelessness being forced into these unsafe congregate living situations. This supports my findings as limited evidence for addressing homelessness in the context of a pandemic has made it increasingly difficult for service providers to form and implement context-specific measures. Furthermore, the intense workloads during the pandemic have had an impact on participants' professional and personal lives. Characteristics of burnout, including emotional, physical, and behavioral exhaustion, can have detrimental physical and mental effects. And while the COVID-19 policies have put additional responsibilities on service providers, they've also changed the way people can deal with these feelings. So, people can't go to the gym, see their family or friends, go on vacation, and do all the things that they normally do to deal with these stressors. So what does this all mean and what can we do about it? So education is essential to teach, not only nurses, but all health disciplines about the implications of health disparities caused by public health policies. Education should emphasize the societal and structural causes and impacts to experiencing homelessness and the importance of equitable pandemic planning and response measures. Implications for policy development include the need to enhance supports around people who are unhoused and without access to this basic human right. Only when change is addressed on all levels can we begin to end homelessness through more community-based initiatives, universal basic income, affordable and accessible housing, and really most importantly, listening to the folks who are actually living in it and working within these sectors. This research has definitely had an impact on me as an undergraduate researcher. I was very fortunate in I was able to gear my project towards something that I'm very interested in and passionate about. I've used my research experiences to inform my work going into shelters where people live to implement COVID testing, as a student and now new grad working within the community, and overall just made me more informed and aware of the importance of incorporating equity into all aspects of education, research, and nursing care. So overall, as public policies have exacerbated the pre-existing issues impacting people experiencing homelessness, they've also shone a light on the immediate and life-threatening needs within this sector. Housing has been reiterated as a key social determinant of health over and over again. Policymakers must take action to reduce structural barriers and improve conditions of homelessness in rural and urban Nova Scotia. So I'm very excited to continue this research with the larger study team at the Canadian Centre for Vaccinology, as well to be able to share my research with you all today. So thank you very much for listening, and I'd be happy to answer any questions or comments anyone has. So thank you.
Thank you, Alexa. Your research is really powerful, and again, as I've also seen you presented a couple of times now, and again, every time I do, there's a different piece that sticks. And today, as I was listening to you speak, and then it's really solidified with this picture at the end, I was thinking about, Stay the Blazes Home, which, was quite funny and quippy when it came out. And, it did really drive home a good message. But, as this picture really demonstrates, what if there's no home to stay in? Or what if the home that you're in is not safe for a number of other reasons? What if it's overcrowded? What if it's a tiny space that isn't suitable for the number of people that are living there? So, that there's that piece about, what we say as public health folks and decision makers to our entire population. I think we need to ask ourselves, how would this be made more difficult? Like this piece of advice, or this program or this choice, how would this be made more difficult if someone is, and in this case, homeless, if someone is racialized, if someone is a member of the LGBTQ2IA community, if they're stigmatized in another way? And that's a really very basic but very easily used health equity type of lens and question for us to ask ourselves. It also, your language around collateral damage is really, really powerful. It's stark, and so that's with me today. And then, the message you ended with, your theme, around behind the mask, really matches well with Claire's theme of doing too much and not enough, and that impact on providers of managing the multiple and intersecting inequities, and feeling like you're constantly working but not making a lot of headway. And I think there's lessons in there for public health and decision makers to learn. So yeah,